I'm used to the crack team. That's what they do to me every Tuesday. Okay, are we waiting for anybody? Is Tony coming?
No, he's at the Hill.
Okay. Okay. Bob's here, Ritz. So D-Mac's here, Angela's here. Everybody's here? So we're not waiting on anybody, right? We good to go? Okay. All right. Good afternoon, everybody. We're going to go ahead and get started. First of all, thank you all for being here on what hopefully is not a real stormy day, but if you listen to the newscast, it might get worse. So today marks the start of an amazing partnership that I'm thankful that all came together, and we're celebrating the work that has been done, and that it really is just the beginning. As I told someone just a minute ago, it's amazing what can happen when we all start talking to each other and we can collaborate. We are all aware that COVID had long-lasting impacts on our community and our businesses. It also took a tremendous toll on our healthcare workforce, but it also presented us with an opportunity, Polk County, when we were awarded $95 million in federal funding through the American Rescue Plan Act. And it would have been really easy, as Sarah likes to remind me, to just divvy up those funds and sprinkle some grants around the community. But we made a decision that we wanted to see this money continue to do work for our community for years to come, for our children and our grandchildren. We wanted to have real tangible impact, so we gathered public input, sometimes painful. We had meetings and we held stakeholders on important topics like affordable housing and mental health. And we created an investment plan that we think will have that lasting impact on our community. Over 6 months ago, we were hearing from our community leaders that healthcare workers were suffering in a tremendous way because of COVID. So we got to work on that issue, gathering leaders, starting conversations, and ultimately creating the foundation for this collaborative. When we first assembled this group, we asked them to take off their own organizational hat and look at the healthcare workforce issue from a wider lens. That was something that I really didn't think in the beginning was going to happen. We asked them to think strategically and collaboratively, and they took that to heart. Staff from our healthcare and education institutions, they worked over 6 months to create this collaboration, and leaders from these institutions, they pledged their support. What this group has put together focuses on a system-wide recruitment and retainment of healthcare students. Many of these organizations have various strategies to recruit new students, but this is unique in that it will provide an opportunity to collaboratively recruit new students, place them in an appropriate education track, and finally, giving them the best opportunity. We hope that this will help us solve our healthcare workforce shortage and will become a model for other communities to look at. We knew that this problem was too large to solve alone, so thank you to everyone being here today for finding a way to solve it. Polk County is more than proud to make this $1 million grant, and we can't wait to see what this collaboration grows into. I hope that we can look back in 10 years and say that this was one good thing to come from COVID, because there really wasn't much, and have a strong collaborative healthcare network that is focused on an overall health of our community. Before I turn it over to the next speaker, I have to say that, you know, we can all stand here as leaders and take a lot of credit, but let me tell you, the staff, and I want to give heads off to Sarah Bass, Sue Huppert, and others that I know were at that table week after week on the Zooms. And really, Mary County, I don't know, she's here with her ashes on her forehead. She's over behind that pillar, that really put this together and said, we can do this, and really had the CEOs of those hospitals saying, make this happen. We want that $1 million. We want this collaboration, and we need this for our community. So thank you to all the staff that really made this happen. So now I want to turn it over to Bob Ritz, my friend, President and CEO of MercyOne.
Well, thank you very much. And certainly, I'm excited to be here on behalf of healthcare organizations across Polk County. And the collaboration, I think, is not something that's hard to believe from my perspective, because one of the greatest things we learned from COVID is that collaboration and partnerships are the way of the future. It helped us get through that time, and this aftershock that's reeling each and every day for us continues to be in front of us, and so we're much stronger together. In fact, the essence of this community is around partnerships. So thank you to you and the other supervisors for making this possible. We're super excited about this partnership. And I stand here on behalf of these healthcare organizations. I'm proud to do so, but they deserve equal, if not more, the credit than I. And the people you mentioned already are the ones who were at the table making this happen. I'm sure it goes without saying that healthcare is no exception, that the availability of people to work in our organizations, both presently and into the future, is a significant challenge. In fact, unlike ever before, it's the greatest I've ever seen in 38 years of healthcare leadership. And I don't think it's going to get better anytime soon. So we have an opportunity. And again, we're not the only industry in this country going through this challenge. This collaboration is exactly what's needed, this new partnership fusing together between education and healthcare with the support of the county. I can't think of a better solution to approach this challenge. And we will be fine. We all find a way to the next day. We all find a way to support our missions. It just so happens our mission is really special because we take care of people at the time of need, whether we're educating professionals to take care of people, whether we have the delivery systems to help take care of people. Our communities, our state, certainly our county, they rely on us, and we need to be here for them. So we're very excited about facing this challenge together. We know this partnership can't stand on its own, and we know it's not a partnership or a collaboration of success without life. And we assessed the whole situation together collaboratively and identified the need for liaisons or navigators to really tie these relationships together in a meaningful way at the primary, secondary, and post-secondary education level, together with our healthcare organizations. They'll help youngsters entering the field, whether it's going into healthcare or just choosing a career, why healthcare is a special career for them to consider, why it's meaningful to work in this area, and how they together can help make the future brighter for Iowans. So we believe these two collaborators that will work between schools and healthcare, students, community, and then the third position will actually be kind of more of a marketing position to create an understanding and awareness that this program's in place and to help people understand what the education requirements, certification requirements are in order to be successful as a young healthcare professional. You know, our parents, our grandparents, our generation all touch healthcare in some way. And we have an obligation to create the future. And doing it together, I can't think of a better way of doing it. So I want to thank all of you, county leadership, for helping us make this happen, your generosity. I think it's going to go farther than if you spread a little bit across the way because you focused it together. And thank all members of the collaboration, both healthcare organizations and our partnership with education, to really do something different and make sure that we live off the life of collaboration we learned during this pandemic. Thank you for the opportunity to share a few thoughts with you, and again, the opportunity to work together.
Good afternoon. I'm Rob Denson, President, Des Moines Area Community College, and I want to start this presentation the same way I'm going to end it. Thank you to the Polk County Board of Supervisors for your encouragement, support, and urging to help bring all of us together to make this collaborative happen. I've said many times, Central Iowa is a very special place. Anyone in a leadership position, we know each other. More surprisingly, we like each other, and we are willing to work together at every level to make sure that we're helping not only our constituencies, but our hospitals and everyone else that we service. This healthcare workforce collaborative is special, and we've already started working. on April 18th from 8:30 to 2 o'clock at Southridge Mall. We've already got at our facility down there, we already have 150 high school students coming in, up to 50 individuals from our various education institutions to work with them with some hands-on training to help show them what these opportunities can be. And I tell you, Des Moines University, Angela Franklin, president, is here today. Mercy College, Adrian Henry is here. And Grandview, Carl Moses, provost. Again, we're friends. We know each other, and we're partnering together. At some level, we compete. But at another level, we're all working together to accomplish the same thing because our healthcare partners, and Bob, you couldn't be more correct. I mean, the leadership of all the various hospitals and medical facilities in central Iowa have been great to work with. And again, you're encouraging us to go to even higher levels to make sure that we're meeting your various needs. There are a lot of middle and high school students that are excited about their careers, but really don't understand what the opportunities are. And this is probably the best thing we're going to be able to do. The Department of Education last year funded college and career transition counselors. Many of our K-12 institutions, the ratio of students to counselors is very, very high, well above what the national average should be. Students really aren't having the time to meet with counselors to talk about careers, whether it's college or to go right into the workforce. So we've hired, I think, 15 in central Iowa that work with the K-12s. They partner with the high school counselors. They're in there talking to individuals, getting those FAFSAs filled out. 40% of Iowa high school graduates are not going on to college. How could that happen in Iowa? So we need to make sure that they get the support they need, and they may decide to go into the workforce, and that's fine, but we need to make sure that it is a deliberate decision and that we're helping provide all the career and college awareness we can in the high school systems. Healthcare is a great field. Everyone's been scared a little bit because of the pandemic. I know we've stressed a lot of our current healthcare providers, and we've made a lot of individuals who are exploring or just trying to decide what to do. You know, they don't know because they really haven't had the exposure and experience. So we're going to show them how much excitement there is and how much value they can get out of that work. So on behalf of the education institutions involved, Polk County Supervisors, thank you so much for what you've done. We look forward to other opportunities to do other grants together, other projects together, again, with the sole goal is to make Polk County one of the best places in the world to live and thrive. So thank you very much.
Okay, well, you know, we always like to give out big checks, so all the partners have to stand up here and we're gonna do a big check presentation. Come on up, Bob. As I always say, the real check's in the mail. Supposed to sit in the bank. Okay, can you get us all in? Okay.
You just scoot in a little bit.
Come over a little bit.
Sorry, I'm right your way. Can everybody look right here at me as well? Okay. All right, right over here. 1, 2, 3. Thank you.
And then go to Sue.
Just slowly get this across the room.
No. Okay, thank you.
Good job.